State University of New York at Downstate Medical Center is your center for healthcare excellence. Housed in an urban setting in Brooklyn, New York, Downstate is one of 64 campuses in the State University system and the only medical school in Brooklyn. More New York City doctors graduate from Downstate than from any other medical school in the country. Health Center is sponsored by SUNY Downstate and delivers up-to-date information in healthcare and community outreach programming. Its university hospital is known for its centers of excellence, quality patient care, cutting-edge education, as a major scientific research center, and for its emergency room, which is open 24 hours. SUNY Downstate's educational programming includes our School of Graduate Studies, which has trained some of the world's best scientists and teachers, including Dr. Robert Furchgott, winner of the 1998 Nobel Prize in Medicine. Also included are the College of Health-Related Professions, the College of Nursing, and our nationally recognized School of Public Health. With so much to offer, there's no better place you can depend on. Downstate.
Live from the Health Center at SUNY Downstate, this is Star for Brooklyn.
Welcome! It's Star for Brooklyn. My name is Tanya Taylor and
Christopher Jimenez. Great to be back with everyone. Tanya, I have a question for you.
Yep.
So since the last time we spoke, how are you being healthier?
Oh wow, that's a great question. I am actually going to the gym to work on my muscle mass and my bone density. As I get older, that's really important. We need to do some heavy lifting.
Definitely. No, that's
about you?
Great to hear. Well, actually, I can't say that I've hit the gym yet, so okay. You're ahead of me. That's a goal, though. But what I am doing now is I'm making sure that whenever I come to work, I use the stairs. No more elevator, walking up the stairs, walking down the stairs, trying to get as much activity in as possible. Because a little something is better than nothing, you know?
Okay, yeah. So what are we talking about today?
Well, we are going to continue to talk about health, but specifically about nutrition, because when we talk about being healthy, of course, you have to find a way to also bring nutrition into the conversation. And it's tough because, right, I mean, we love to eat, we like good foods, and we shouldn't deprive ourselves, but at the same time, we should find the balance.
Excellent. So we would like, Star for Brooklyn would like to welcome our guest today. Please help us welcome Jackie Brockman, who is a registered dietitian. Hey, Jackie, come on over.
Hi.
Hey, Jackie, great to see you. Thanks for coming.
Thank you for having me.
Welcome.
So, Jackie, the first question I wanted to ask you, I've been thinking about this for a while. You know, you read all this stuff about, here in America, us as Americans, we consume way too much sodium or salt, right? And you don't know what's real and what's not out there, especially these days, but you're an expert, you're a registered dietitian. So, do we consume too much sodium? Is that really a problem here? And what can we do to kind of not make it such a problem, in our lives?
That's a great question. Yes, we on average consume way too much sodium. The typical American diet is, it contains 2 to 3 times the amount of sodium that we should be consuming on a regular basis.
Oh, that's a lot.
It's a lot, and too much sodium definitely will wreak havoc on our health long term. It increases our risk for high blood pressure, high cholesterol, heart disease. It also impacts the kidneys.
Wow.
Okay.
And Jackie, how much sodium should we consume a day then? Like and how do we even, measure that, right? Because it's like, do I have to go into a store or a restaurant and have a calculator? Sometimes it can be a little cumbersome. So what would you suggest? What do you think works?
Yeah, in general, I think, a few easy tips I often provide are, we have to look at where our food is coming from. Where are most of our meals coming from? Are we preparing them mostly at home? If that's the case, we're probably not consuming as much sodium as the traditional typical American. However, if we're eating out frequently, even if we're ordering lunch on a regular basis. So Monday through Friday, we go in and buy lunch from the cafeteria or the local restaurant or a fast food chain. We will likely be consuming more sodium than what we should be doing. And more research is going into this, but recent research studies are showing that we should be consuming less than 2,300 milligrams a day. And the typical American diet it contains over 3,500 milligrams a day. Wow. So again, like long term, too much sodium can definitely take a toll on our health.
I'm so happy you're here. I have so many questions. I also have a question about sugar.
Oh, yes.
Because I think just like sodium, that there's a lot of sugar added to our foods. So my question's kind of twofold. So I want to know if you are pre-diabetic, and I am pre-diabetic. When I feel really kind of sluggish or tired, because I know that there's a difference between hypoglycemic and hyperglycemic, and I don't understand sort of how would I know what to do because I'm not taking my blood sugar.
Yeah, often people get confused about this topic. So
Do you want to tell people what hypo and hyper?
Sure. So basically, hypoglycemic just means that your blood sugar is running low. Hypo meaning low, and hyper meaning high. So your blood sugar is running high if you're hyperglycemic. So but the concern comes with how are our blood sugar levels how are they controlled long term? And if our blood sugar is elevated in an abnormal level, an unhealthy level long term, that causes damage to the entire vascular system.
What can I do in terms of nutrition or other things to prevent damage or prevent me from getting the disease of diabetes and sort of scaling it back so I'm no longer pre-diabetic?
Okay, so first off, we want to get an annual physical every year, right? We want to make sure our A1C level is essentially the lab that we should get checked. And that is a measure, it's a 3-month average of our blood sugar. So once we know what our A1C is, if it's normal, great. We want to just maintain a healthy lifestyle. However, if you start seeing the A1C creeping upwards, if it starts becoming in a pre-diabetic range, then there are a lot of things that we can do. We should stay active. So you going to the gym and exercising is really important. You're doing a good job. The reason exercise is so important is because when we activate our muscles, our insulin actually becomes more sensitive. And when our insulin is more sensitive, it actually grabs hold of the excess glucose in the blood and brings it down. So our insulin works really well the more active we are.
When you say active, Jackie, do you mean like we have to go out there and like run a sprint, or like when you say active, like what do you mean by active?
Move.
Just move.
Just move. What's happening nowadays is we're sitting too long. We're sitting for hours nonstop, and us sitting and being sedentary, that increases our risk for high blood sugar, diabetes, heart disease even. Yeah. It's becoming, I think it's been deemed the new smoking. Like sitting is the new smoking. So sitting long periods during the day does take a toll on our health.
Wow, we've learned so much in terms of how nutrition and diet are also connected to our lifestyle behaviors. Thank you so much for coming. I have more questions. Maybe we can have you come back.
Yes, you need to come back, Jack. You need to come back.
So much, because this is a really important topic. Yeah. Thank you so much.
Thank you for having me.
Welcome back, everyone. So we have something really cool and unique that we're going to do right now. Tanya, would you like to introduce our next guest?
Absolutely. Look at this. This is so cool. So we'd like to introduce you to Mary Crimes, who is the charge nurse at the Star Health Center. And she is an AIDS certified registered nurse and an amazing, amazing woman. So you're here to tell us about your Tambourine Kitchen?
Yes, I am.
Oh my gosh, I'm so hungry. What's going on?
Mary, I want to say that after this segment, a star would be born, but you were born for this. So please,
Yes, yes.
take it away.
And I will sample anything.
Okay. All right. Well, hello, everybody. Thanks for having me.
Yeah.
And this afternoon, we're going to be preparing a salmon and macaroni salad. Basically the same thing as tuna fish and macaroni salad, but using salmon instead. Okay, so we have our noodles here. These are called cavatappi noodles. They're a little more, they're like a swirl or the longer version of the elbow macaroni, because I find that the salmon sticks a little better to something when it's curved. I don't know, that's just me. Okay, so we're gonna start with the macaroni.
And how much is that? Is that a whole box? or-
No, this is like maybe a half a pound,
Okay.
a half a box. I'm not even gonna use it all. Then we have your salmon, which is it is canned salmon, but it's also very healthy. It's, because salmon could be a little pricey. So when you catch a bumblebee salmon in a can on sale, you buy it, okay? So I try to stack up on it. So here we go. Then we have boiled eggs, chopped.
Okay. It's a double protein.
Celery, chopped, like
Okay.
2 stalks of celery.
That's like finely chopped. too.
Yes, I have my, oh listen, I couldn't bring everything here today, but I have all kinds of kitchen gadgets and I
Fancy
love it. That
Cuisinart.
You know, that was just
push
what I was
it down and
That was just what I was going to ask you,
And
Mary. So
voila.
how long does this everything take to prepare, would you say?
I'd say maybe, well, if you're talking about starting from really like scratch, because you have to boil the macaroni first, of course. And while the macaroni is in the pot boiling, I'm doing all the other stuff. So all in all, maybe 40, 45 minutes total to
Okay.
get everything prepared.
Okay.
Okay, so we mix it up a little bit here.
Wow, that's pretty.
Yeah. And then, of course, we have to add our mayo.
Real mayonnaise.
Real mayonnaise.
Yeah,
Yeah. I know
stuff.
we're supposed to be a little health conscious, but
I was just going to say that, yeah, but
yeah, it's not fat free. Sorry.
but you know what?
But isn't it the good fats? No, it's not the good fats.
Okay, and here we go. And take certain things in moderation. You know, like you have to watch your salt content depending on who you are and what you know, how you were brought up and raised. Because some of us were raised using heavy seasoning, so you have to kind of slight the hand a little bit. So just a little sprinkling of
And what kind
seasoned
of
salt.
That's seasoned salt? Okay.
Okay, some black pepper.
But I was also going to say, Mary, this is not for one person. So we saw you put a lot of mayonnaise in,
No.
but this is for multiple people.
Yeah.
So, you know, it's not like we're totally unhealthy here.
And we also have a little Cajun seasoning to add a little flavor to that salmon, bring it out a little bit. Okay,
I would have not thought to
And-
put Cajun seasoning in that. Okay.
yeah, and some paprika for coloring there. Okay, and then we mix. And
you
while
wanna add this?
I'm sorry. Oh, thank you, Tanya.
There we go.
Got my little garlic powder,
I'm
just a
taking notes
tad.
here.
Great
Okay.
assist there, Tanya. Great
All
assist.
right.
Yes, thank you. And just to let you guys know, so if you have to step back a little bit because then I'm cooking,
Sorry.
I'm dancing.
Oh, okay.
Dance to the music. Yes. So we
So this
stir.
is also sort of like how you
Yeah, I keep it
while
in
you're-
shape, you know, and I also live on the top floor of my building, so I get plenty of exercise. And I walk up and down the hallways of the clinic, so I get a lot more exercise. But I think we need to add just a little more mayo,
Okay.
you know, just my judgment.
And the name of your catering company is called
The Tambourine Kitchen.
Tambourine Kitchen. We should also let our audience know that Mary really does seriously move, and she dances, and she is an
I play
incredible
my tambourine.
joy.
Yep.
And
Not while I'm
many
cooking,
time
though.
we see her singing and dancing with her tambourine.
Okay. So the end result is about right. I have enough of everything in here.
Okay.
And of course, I do a little tasting. Do I have an extra spoon somewhere?
We can
I
find.
don't know where this
Actually,
are. Wait,
can
this
we
is
find one?
torture.
Do we have?
utensils.
We do not have an extra spoon right now, but that's
We're gonna
okay.
get it.
That's
We're
okay.
gonna get it. We're gonna
Yeah.
get it.
So, like I said, then we transfer
Is
into
this,
the
is this
pan.
the only one? Okay, so one of us can maybe.
Go for it. Tanya. Go for it.
Okay. Well, should I let you, or should I go for it?
The only thing I do have to say about certain salads, especially salads that have raw vegetables in it, it does need to sit for a little while to bring out the flavor. Okay, so when you taste it now, it might not be as good as it's going to be 3 hours or 4 hours.
That's a
from
great
now.
tip, Mary. Let me tell
Yes.
you, if it was me, I could barely cook an egg. So yeah, I probably wouldn't. I'd probably just start eating it right away.
Okay.
Okay.
1 second. Wait a
I
minute.
think
No,
I
no,
see
no. We have to
magic
put the little
spoons.
garnish
Magic
on there.
spoons
Excuse
coming.
me, homie.
There we
Let me hold
go.
this a second. Just kind of spread it out so to fill out the pan.
I'm getting ready.
And just end result, sprinkle a little
Oh, that's
paprika on
really
top.
pretty. Garnish.
Yeah, sometimes,
You
yes.
need to garnish.
Sometimes food can,
You need to make it pretty.
just a little bit of something on there will make it, just like the folks in nursing homes, you know, they don't like their food because it's just like,
bland. No,
looks
but
like
this,
a plain
this
face.
makes you. This
You
makes
know,
you
so when
wanna
you put a
get
little
into it.
garnish on there, you
Yeah.
could put a little
nice.
parsley on there, you know, just to give it a little garnish and make it look nice. So, guys, help this out.
Okay, so you got one too, so we
Oh,
can
let
go
me,
for
let
it,
me make sure. Hold on.
and then we can go for it, right?
That's what I'm talking about.
Okay, all right.
There you
I've got
go.
my little
Here we
piece
go.
here. Thank you.
Thank you very much, Mary.
Whoa! Amazing. Excuse me for talking with my mouth.
Tremendous.
Wow, this is wonderful. Thank you so much
Thanks for coming,
for
Mary.
coming and
Thank you
sharing
for
this
having me.
really awesome salad. I hope everyone was paying attention so that you can do this at home. Thank you so much.
Thank you.
I think we should all
Thank
do
you,
our
Mary.
little
Thank you.
tambourine dance.
Yes.
Mary, when you come back, can you cook the cake, please?
Oh,
Please?
okay.
Okay.
Please?
Thank you.
All right.
My name is Mary Crimes, and I'm the charge nurse at the Star Health Center, and I have been here for 15 years. It's been a good journey, I have to say, though, because Star is like one big happy family, and we all kind of collaborate together, do things together. We have patients that have been coming here for 20, 25 years, and those that go and leave, most tend to come right back to Star. Dance, dance, dance. That is one of my favorite things to do when I'm not working. I go dancing. I love to cook. I also experiment on my coworkers. I make different recipes and bring it in for them to taste. I am healthy for me. Be healthy for you.
Welcome back, everyone. And once again, big thanks to Mary for coming and giving us a sample of her salmon macaroni salad. So we have two very special guests here that are going to talk about something that's really important. So with me today are Dr. Jamila Yusuf and Tracy Griffin. Dr. Yusuf is the medical director for the Star Health Center and STAR program. She is an MPH, a fellow of American College of Physicians, and associate professor of medicine at Downstate University. And Tracy is prevention program manager and an MHA. Thank you both for being here.
Thank you.
Thank
for having
you.
us.
So, Dr. Yusuf, oh, and do you want me to call you Jamila or Dr. Yusuf? What do you?
Jamila's fine.
Jamila? Okay, great. Jamila, I guess first things first, you know, what is PrEP PEP? You know, I go outside, you know, on the side of buses and even in the trains and subways, you know, I'm starting to see this more now. And when I heard that you guys, you know, specialize in this and down at the STAR Clinic, we do this, I wanted to ask you, like, what is it exactly so that our audience can find out?
Sure. So PrEP is actually a shortened term. The full name is pre-exposure prophylaxis. And what that is, it's HIV prevention. So it's the way it works is that we would give HIV medicines to someone who's HIV negative. And this will prevent them from becoming HIV positive. And it's about 90% effective. So it's actually more effective than a flu shot. It's very effective.
Wow. So Tracy, my question to you, you know, as the prevention program manager, I know you're out there in the community a lot. What are some of the initiatives that you're doing to let the community know that this even exists? I mean, I know, like I talked about bus signs and advertisements, but sometimes people, you know, they see it and they don't really pay attention. So what are you doing to kind of let people know about this amazing new treatment?
So the advertisements that you see are from Department of Health, and we kind of piggyback on that, and we go out to the community, different places, community organizations, churches, community centers, senior citizen centers, and we kind of go in there, we give them education, we talk about all kinds of things, including sex, and PrEP and PEP fall into that. We offer testing, free HIV testing, and then we just kind of create a platform so that we can talk about PrEP. So for the community, we just kind of offer our services to everyone. We can just be out on the street, on the sidewalk in front of the hospital, just talking about PrEP and just giving basic information about PrEP and PEP and the differences between both.
You bring up a good point, Tracy. So I'll throw it back to you now, Jamila. PrEP and PEP, and I always see it together. So it says like
Right.
PrEP and then /PEP. What are the differences between the two?
So PrEP is pre-exposure prophylaxis. So the medicines should be taken before your exposure. And PrEP doesn't work immediately. It takes about 7 days to be effective for receptive anal sex and about 20 days to be effective for receptive vaginal sex or to protect someone from intravenous exposure to HIV. With that said, if someone is already exposed and it's within 72 hours, then they are eligible for something called PEP, which is shortened for post-exposure prophylaxis. Now, we consider, in the medical community, we consider post-exposure prophylaxis a medical emergency. The patient, if someone has been exposed, should go right away to an emergency room or to a clinic to get put on 3 medications instead of 2. And
So that's the big difference, right? Like, so it's kind of a
Yes.
stronger regimen because
Yes,
it's after the exposure.
It's after the exposure because PrEP won't work. It takes 7 days. So you need something after the exposure. It's 3 medicines and you need to take it for 28 days. And that has to be taken within 72 hours of your exposure. So either going to the emergency room or coming to a clinic that can provide that medication.
So basically what would happen, and maybe you could jump in on this, Tracy, since you're out in the community. So you would tell some, members of our community, if you have been with someone unprotected and you don't know their status within the last 3 days, you should go to get tested.
So our program, we are fortunate that we are one of the recipients of a grant that provides the PEP medication for those who have been exposed. And so essentially what we do is they come in, we do an assessment to see which program they're eligible for. The timing is crucial because that dictates whether they're going to do PEP or PrEP. So once we discover that they are eligible for PEP, we do the assessment, we talk about the exposure, what happened, the type of sex, if there was any drug use or alcohol use, because we really want to hone in on the behavior and try to work with them to see maybe we can adjust what's happening in the midst of talking about and giving them PEP. So once we do that assessment, we have to talk about who's going to pay for it, right? So what we do a insurance assessment. And basically we're just seeing if that person has insurance. They have insurance, great. We go through the insurance, we figure out what they're going to pay for. If there are any lapse, meaning if they do not cover the medication, we are able to provide medication. For those who do not have insurance, we're also able to provide both medical services and medication. So there's essentially no reason someone who walked in off the street and who's had an exposure cannot access the medication.
You know, Jamila, one thing I wanted to ask you, so, and that's great information. So basically, this is available to everyone. It doesn't matter what your insurance status is, what your income level is, you can get this. When someone goes, let's say somebody, has had unprotected sex in the last 3 days, and they end up going to the emergency room, what would happen in that case?
So they would get HIV tested. They would also get screened for other infections, and they would get started on medications immediately. And then also linked to a clinic where they could follow up for another HIV test after 28 days, as well as follow up for medications. And we often see those patients in our clinic as well.
Yeah, there are some cases where the emergency room does not provide the full 28 days, so they're linked to special programs like ours. There's only 4 within the whole city that are able to provide PEP, full PrEP. They're linked to the program, and they are given the remainder of the medication.
Thanks. And the reason I asked that question, guys, is because I've had a couple of patients come to me and just kind of speak about that experience.
Right.
But anyway, I really appreciate you guys coming to speak. This was very informative. Please come back.
Sure.
And, just thank you so much. I mean, this is great information. Hopefully everybody out there listen to it. And, if you feel like, even if you know somebody who might benefit from this, please let them know. And if any questions, again, please check out our website, starprogram.nyc. Again, that's starprogram.nyc. There's more information on PrEP and PEP on our site. Thank you.
Thank you.
Chris, I'm so excited about our next segment. We're going to be talking about a case management program to help people who are at risk of HIV to find out about PrEP and to get linked to PrEP. We have two guests visiting today. They are both from the Star Health Center at SUNY Downstate Medical Center. I'd like to introduce you guys to two amazing people. This is Lori Hurley, who is the Assistant Director of Case Coordination. And then we have Alain Gauthier, who is the PrEP Entitlement Care, is that right? Case Manager. So welcome, guys. I'm so excited. Like, this is complicated. I need to understand this. So what is this status neutral program?
Well, this program is based on the philosophy that good health is just more than medicine. And so we all know about PrEP. We've been talking about how PrEP is a great intervention. It's a medical intervention, though, and people lead very full lives that have a social aspect, an economic aspect, a stigma aspect, and we're here to help address those kind of things and help people address the barriers to getting in, to decide whether or not that PrEP is right for them.
Oh, okay. So, Alain, this is actually what you do. You help
That's
people with
right.
the barriers. Can you tell me a little bit more about your work?
Yes, I'm usually trying to find out with the patient what their needs are. Because sometimes we try to offer a service, a product, and we don't necessarily, I'm seeing the need from the other person. So we try to find out that together with the patient. And then trying to find a solution and get to the point where the patient can make a decision about PrEP, if it's good or not for them.
So it's very tailored to that person.
Yes.
So what are the common needs that you guys are seeing in terms of being barriers to people finding about PrEP, getting linked to PrEP? What are the common needs?
Well, one big need would be health insurance. Not everybody has insurance or the right kind of insurance, and so Alain is a big help with that. He's a certified application counselor who helps people get onto insurance.
Oh,
Yeah.
okay.
Yes.
That's a difficult process, right?
Well-
Linking people to insurance.
It may be, it's not difficult if you have the tools. We usually go through the state, your state of health, the marketplace for health insurance. And if the patient doesn't qualify, we can always find another program that help cover the cost of the medication and the labs and doctor
that's
visits.
great for people to know that there's always a
Absolutely.
solution, that insurance is not a barrier. So thank you.
Thank
you
you,
guys
Tanya.
very, very
Thank
much.
you.
Thank you. Wow, that was so much fun.
You know what, Tanya? A lot of fun and a lot of great information.
Yeah.
And the one thing I want to just tell our audience is that, there's a lot of stuff that we talk about, and it doesn't mean that you have to do it all at one time. Just take one thing you heard from today, and if you can take one thing and start on that path, then you're doing good,
Excellent. And I want to share with you that you can also share with us how you are staying healthy on social media. And don't forget, #BeHealthyForYou.
One more thing, Tanya, also check us out at starprogram.nyc. Again, great website, a lot of good information there. So if you have the chance or the time, starprogram.nyc.
And #BeHealthyForYou. Bye.